If your morning erections have started to fade after 40, it's not just age. In most men, there's a fixable reason hiding in plain sight: sleep and oxygen, testosterone rhythm, blood flow, and surprisingly, the prostate. And here's the twist. Testosterone usually isn't the first culprit. But if it's not testosterone, what is? We'll get to why that matters in a second. First, let's reset what morning wood really is. It isn't simply desire. It's the last of several automatic erections that happen during REM sleep. Think of it as a nightly systems check, nerves firing cleanly, the endothelium releasing nitric oxide, blood flowing into the penile tissue and staying there. When that reflex fades, your body is telling you something about those systems. The question is, which one changed first? Here's where it gets surprising. The most common reason I see morning erections drop off after 40 is sleep quality, especially sleep apnea. When you snore or stop breathing, your oxygen dips, and your brain keeps yanking you out of REM, the very stage that triggers these erections. Fewer REM cycles means fewer morning erections. Treat the breathing, and they often come back within weeks. If your partner notices loud snoring, gasping, or you feel wiped out during the day, keep watching. We'll talk about what to test for in a moment. Now, hormones. Testosterone does matter, but not in the way most men think. After 40, the morning spike of testosterone flattens a bit. Add extra belly fat, late nights, or high stress, and that peak blunts even more. Lower testosterone doesn't erase erections altogether, but it reduces the frequency and spontaneity, especially those automatic morning ones. If your morning erections are fading and your desire is down, that combination points us to check the numbers properly, early in the morning, on 2 separate days. But hold that thought, because there's another piece that often shows up even before hormones. Circulation is the quiet driver. The penile arteries are tiny, so they're often the first to feel any trouble with blood pressure, blood sugar, cholesterol, or smoking. High sugar dulls nitric oxide. High pressure stiffens the vessel walls. Over time, the inflow gets sluggish, and the morning erections are the first to fade. Here's the part most men miss: changes. In morning erections can precede broader cardiovascular issues by years. That's not meant to scare you, it's meant to give you a head start. We'll get to the simple tests that catch this early. And yes, the prostate plays a role, not because it directly blocks erections, but because a growing prostate makes you get up to pee at night. Every bathroom trip pulls you out of REM sleep. Fewer REM cycles, fewer automatic erections. Some prostate meds can also affect sexual function. If you've noticed more nighttime urination and weaker morning erections, that combination is a clue. The good news is that when we treat bladder and prostate symptoms and restore solid sleep, the morning erections often strengthen again. So how do you know what's normal versus a red flag? An occasional off morning is normal. Look at the trend. If you used to wake with an erection most days, and now it's rare for months, especially if you're also snoring more, feeling low energy, or getting up to pee, it's time to investigate. And if you're under 50 and this change was noticeable, pay extra attention. Early fixes help the most. We're about to talk action steps you can take this week. Start with sleep, because it multiplies benefits everywhere else. If snoring, gasping, morning headaches, or daytime sleepiness sound familiar, ask for a sleep evaluation or a home sleep apnea test. Treating sleep apnea often with CPAP or a mouthpiece can restore REM, raise morning testosterone, and improve erections all at once. Many men see changes within 4 to 8 weeks. But sleep is just the first lever. Next, check hormones the right way. Get a morning total testosterone, ideally between 7 and 10 a.m., and repeat it on another morning if it's borderline. If symptoms and labs line up, treating truly low testosterone can help bring back spontaneous erections. It's not a shortcut around lifestyle or sleep. Think of it as the amplifier once the signal is clean. We'll pair that with something else that really moves the needle. Don't skip the circulation piece. Ask for an A1C, fasting glucose, a lipid panel, and a blood pressure check. Even mild elevations in sugar or pressure can blunt nitric oxide and reduce morning firmness. The encouraging part is how quickly this can turn. Better sleep, a bit of weight loss around the waist, daily walking, or resistance training, and dialing down alcohol near bedtime often restore morning erections in 6 to 12 weeks. If you and your clinician use a PDE5 inhibitor like sildenafil or tadalafil during this phase, think of it as support while you fix the root cause, not the whole solution. If nighttime urination is waking you up, address the prostate. Limit fluids 2 hours before bed. Ease off caffeine and alcohol late in the day, and talk to your clinician about medications or other options if symptoms persist. The goal is consolidated sleep, more uninterrupted REM, more automatic erections. And if a new medication lined up with the change, some antidepressants, certain blood pressure meds don't guess, ask whether there's an alternative. Small tweaks can make a big difference. Here's the bottom line. Morning erections fade after 40, mainly because REM sleep gets disrupted, the testosterone peak flattens, small vessel blood flow takes early hits, and the prostate starts fragmenting your nights. The fix is rarely one pill. It's stacking wins, restore sleep and oxygen, check and treat low testosterone when it's real, tune up circulation, and manage prostate symptoms. Do that, and in many cases, the morning erections come back, and your overall health improves with them. If this helped you connect the dots, please like the video and subscribe so you don't miss the next deep dive. And if you're noticing these changes right now, book your sleep and lab checks this week. Catch it early, fix the cause, and let your mornings be your proof.